Mia Milan, who's the editor-in-chief at the Bheki Center Center for Health Journalism, is with us in studio. And Mia, now we're trying to unpack the kind of interventions really that exist to try to help people who do develop long COVID.
Yes, Yanda, and we're also trying to figure out how do you know if you've got long COVID, just how long is long, and what kind of symptoms do you need to have. So to help us figure that out, we have the head of South Africa's only long COVID clinic here in South Africa. It's based at Groote Hospital, and we're going to speak to the person who heads that up, who is Dr. Rubeshan Perumal, and he, as I said, is based in Cape Town and is joining us. Dr. Perumal, welcome, and thank you for your time on the show. How do you know if you have long COVID? How do you know if the symptoms you have qualify for long COVID?
Well, good morning, Mia, and good morning to your viewers, and thanks for having me talk on this important subject. You know, long COVID essentially reflects the persistence of symptoms for 4 weeks or longer from the acute illness. And in fact, some patients have few, if any, symptoms during the initial period, but may go on to develop symptoms down the line. And so it includes both groups of patients, those who have symptoms which persist and those who develop new symptoms 4 weeks or more from their initial illness.
So do we have an indication as to what proportion of people who have acute COVID would go on to develop long COVID?
Well, we're slowly beginning to understand that long COVID can occur across the spectrum of initial severity. So patients who are severely ill in ICUs go on to develop long COVID, but some patients who are minimally symptomatic may also go on to develop long COVID. Of course, across that gradient, there's a greater risk of developing long COVID if you're more severe during your initial illness. But on the whole, about 30% of patients are unrecovered at 3 months from their initial diagnosis. So, you know, that's a substantial number of people. 30% of the 2.8 million or so South Africans who've had confirmed COVID-19 leaves us with an expected estimate of about 900,000 people, almost 800 to 900,000 people in South Africa who already need long COVID care.
So if you then give them care, what are the types of care that such patients need? Because you've mentioned there's such a wide range of things that can go wrong. So I would imagine it's a very holistic approach.
Really, what is needed is a multidisciplinary approach. You're quite right. The symptoms which patients present with are quite varied. The most common of them are fatigue, persisting shortness of breath, an intractable cough, cognitive difficulties, or what patients describe as brain fog, sleep disturbances, anxiety. And so you can see that these sort of symptoms can arise from many different places. Sometimes we're not even able to identify where the source of the symptoms are, but we really need a multidisciplinary approach, a good, thorough evaluation of the patient to separate out what are complications from the acute illness, what is coming from organ damage from the initial illness, and what is really this entity of long COVID, which is an almost inexplicable persistence of symptoms in patients who sometimes have normal tests when we evaluate their organ function and so on. And so, at our clinic, we have a broad multidisciplinary team. It's led by pulmonologists like myself, who have our primary interest in the lung. But we, very quickly realized that we weren't going to be able to, attack this problem by just looking at the lung. And so we have a neuropsychologist who has to look at the patient from their cognitive perspective. We have teams of allied health professionals, including physiotherapists, occupational therapists, dietitians, and we readily call on the diverse network of providers in Groote Hospital to support and evaluate patients on all the other fronts: cardiac, neurological, hematological, and so on. So, you're quite right.
Dr. Perumal, thank you very much for your time and sharing your expertise today. That was Dr. Rubeshan Perumal, who joined us from Cape Town.